Skin lesions on the foot are so painful. The most common ones are warts, corns, and calluses. And the problem with those skin lesions is they pretty much look just like one another. But it's important to know what they are to be able to treat it to get rid of it. And in this episode, I'm going to share with you how to distinguish between a wart, corn, and callus, and briefly share how to treat them as well. So stick with me. Hey, it's Dr. Gaffney. Thanks for joining me today. I'm helping you save time and money in your foot care decisions with my channel, and I appreciate you watching. So if you're confused about whether or not you have a corn, wart, or callus, don't feel bad, because many doctors that refer patients to me for a wart actually have a seed corn or a callus. So in this episode, I'm just going to share the key features that distinguish between a wart, corn, and callus, and briefly discuss treatment options as well. So in general, corns and calluses are a buildup of dead skin caused by friction or pressure, and it's usually due to a bony deformity like the knuckle of a hammer toe or a prominent bone on the ball of the foot rubbing, causing pressure. Warts, on the other hand, are caused by a viral infection, and the virus infects the top layer of skin. This viral infection causes a lot of dead skin buildup overlying the wart. So the dead skin buildup is the same type of tissue that causes a corn or a callus. It's called hyperkeratosis. So it's yellow tissue. And that's why they become indistinguishable from a corn or a callus, because there's callus over top of it. So once this hyperkeratosis, or the yellow dead skin, is pared away or shaved away by your doctor, it reveals the characteristics of the wart, and that's how you can tell if it's a wart or not after you shave off the dead skin overlying it. And this is where doctors miss it, because they don't usually shave off the dead skin over top of it. So the key features of a wart that differentiate it between a corn and callus are as follows. So number one is location. So normally a wart does not usually occur over a bony prominence like a corn or a callus would, but it can. Now, these next features of a wart can only be discerned after the dead skin is shaved off over the top of the wart. Number two, the surface. It's usually bumpy underneath there. It looks like a cauliflower surface. Number three, usually a wart has areas of pinpoint dried blood. And these are usually the little blood vessels growing up into the wart. Number four, the skin lines are usually interrupted with a wart. Number five, a wart is usually circular and well defined. Number six, warts are very contagious. Number seven, warts can spontaneously resolve without treatment, which is great, but this usually only occurs in children. And number eight, this is another great thing about warts. After it gets effectively treated and totally resolves, it normally does not recur. Hey, if I'm helping you at all, please like and subscribe to my channel. I appreciate that very much. Key features of a callus include, number one, the location. It's normally located at the ball of the foot, and it's normally due to malalignment of the metatarsal bones. And the metatarsal bones make up at the ball of the foot, and as it gets malaligned, it creates pressure points, causing the callus. Another common area for a callus is at the bottom of the big toe joint, and this is usually due to hyperextension of the big toe joint, which is the result of limitation of range of motion where the big toe connects to the foot, and we call that hallux limitus. It's quite common. Check out my episode on how to get rid of a big toe callus here. Calluses are usually larger and they tend to spread out, but they can be smaller, but when they're smaller, they usually are very painful. Normally, they're uniformly yellow. Calluses are not contagious. They usually recur after removal because you need to correct the underlying bony deformity to resolve them completely. Key distinguishing features of a corn are, number one, normally it overlies a knuckle on a hammer toe rubbing in the shoe. Sometimes you can have a soft corn, and these are white and usually between the toes. This is usually from crowded toes and prominent joints rubbing against one another. So they're softer and usually white because of the moisture between the toes, and that's why we call them a soft corn. An exception to the corn being located on a toe would be a seed corn, and seed corns are usually caused by friction and gait, and they're real tiny and occur at the bottom of the foot. Seed corns are commonly confused with warts by primary care doctors. Number 2, corns are small and yellow and look like a kernel of corn. Number 3, corns are not contagious. Number 4, corns recur after you remove them unless you treat the bony deformity underneath it. Okay, so how can corns, calluses, and warts be resolved? Oddly enough, warts are easier to resolve than corns or calluses. And this can be done at home sometimes, but I always recommend that you check with your doctor and see your doctor before you attempt any of these treatments on your own. So corns and calluses are very difficult to remove permanently because they're the result of an underlying bony deformity, and you have to correct the underlying bony deformity to correct or remove the corn and callus permanently. An exception to this rule would be corns. Now, if you would go in your bare feet all the time, then the corns would probably resolve, but that's kind of unrealistic to do in today's modern world. But there are many ways you can be comfortable with the corns and calluses and keep them at bay so they're not causing problems. You can start by wearing a high toe box shoe with a stretchy upper and a cushioned liner. Ultras and Bronacs are good choices. There's many cross-trainer sneakers with a stretchy upper that would be good. Anatomical toe box is also very good. You can wear felt adhesive corn pads or U-shaped callus pads, and these will help to offload the lesions, and I'll have links for those in the description. They're very helpful, as well as silicone pads as well. Calluses at the ball of the foot are best offloaded with an orthotic and the offloading padding attached to it. So once a week, I would advise my patients to go ahead and soak your corn or callus with a water-soaked gauze for about 15 minutes, and then use an emery board to sand it down. I would recommend leaving 1 to 2 layers because the corn or callus is your skin's protective reaction to pressure. So that's why I tell people to leave about 1 to 2 layers when they're taking it down, because if you take it down too far, your skin will get irritated and you may even get some burning pain afterwards. So the next night after you're done sanding it down, I usually tell my patients to get 20 to 40% urea and just put that on the lesion at night. The urea will help keep the lesion soft and prevent the buildup. I'll have a link for the urea also in the description as well. I discourage the use of over-the-counter corn and callus remover with salicylic acid. It's very strong and it can easily cause a wound or irritation if it's not used properly. And I definitely don't recommend using corn or callus remover in a diabetic or anybody with poor circulation, because wounds can be catastrophic in that patient population. And for more on how to resolve corns, please see my episode on that here. So podiatrists can help you find the best offloading devices, as well as guide you in shoe selection and orthotic use and shave the corn and callus down properly. I definitely don't recommend people using sharp instruments on their foot to shave off their corn or callus. I know people do it, but the foot is very unusual structure. It's very curved. It's extremely easy to hurt yourself because it's hard to reach your foot. It's hard to see what you're doing. Also, when the time is right and a patient is a good surgical candidate, the bony deformity can be corrected to resolve the corn and callus permanently. Warts, on the other hand, can be removed with over-the-counter treatments sometimes. The callus tissue overlying a wart is very dense and proliferates very quickly. So typically one needs to go see a podiatrist to have that shaved off and treat the wart. Over-the-counter treatments usually involve salicylic acid to treat the wart. The same risks, however, pertain to treating warts as they do with corns and calluses. However, the dense callus tissue overlying warts is so thick and dense that you need to have the strong salicylic acid to treat it. Again, diabetics and those with poor circulation should never use salicylic acid on their foot. If you're not diabetic and you have healthy feet, you still have to be very careful when treating your wart with salicylic acid and protect the surrounding healthy skin so that doesn't get irritated. So this salicylic acid treatment is done daily, and a podiatrist usually will prescribe another topical medicine to kill the wart at the same time. My favorites were Aldera and Effudex cream. Another one of my favorites that can be purchased online and is over the counter is called Veerson. Now, if you're faithful with the daily treatments for 6 to 8 weeks, the warts should resolve. If they're not resolved in 6 to 8 weeks, then advanced treatment is usually undertaken with your podiatrist. And if you want to learn more about advanced treatments for warts, please check out my episode here. So in general, warts, corns, and calluses all can look the same. The key difference is location and shaving off the dead skin to see what it looks like underneath it. I advise you to see your doctor to get proper treatment. So what has helped your wart, corn, or callus? Let me know in the comments. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.